Hello, everyone. This is a live feed to find more information information on the vaccination programme. I'd like to introduce myself and my colleague Debisi. I'm Jackie Davidson. I'm the programme lead for the vaccination programme in Greenwich. I'm also a public health consultant. My colleague with me today, who you can see, is Dr. Debisi Olunluyo, and she's with me and she's going to answer any questions that you may have. As people will be aware that the vaccination programme has now been announced that it's going to roll out to the 12 to 15-year-olds. And Greenwich is working with the local schools to implement this programme. You've been invited to this event because your school is one of the schools who are going live with this programme, and so what we wanted to do was give you a lot more information. So my understanding is that how it'll work is you post your questions, and I will ask them to Debisi, and Debisi will be able to respond. If there are questions that we're not able to respond here or on other matters that aren't the vaccination programme, we will take those away and we will be able to respond. There is a Facebook live feed which will be available afterwards in a chat, so you'll be able to continue to ask questions even after we finish and also receive answers to those. So please keep checking those. So what I'd like to do is invite, I would like people to invite people to put their questions in the chat so that we can kick off this session quite quickly. But just to let you know that as you'll have seen, there's a lot of information about the vaccine programme. Many of you may be vaccinated yourselves. There's lots of media attention about the vaccination programme with the 12 to 15s, and there's lots of misinformation too. So all this programme is really about is to give you the information that you might need so that you can make a decision about parental consent, and because it's really important that you have all the information so that you can decide. As most people will be aware, the programme is required to have parental consent beforehand, and you will have been sent information from that. Right, I have my first question that's come through, which I'm going to ask. The first question is from Helen Cunningham. What she has asked is, what are the risks of young people having the vaccine, Debisi?
Hi, thank you, Jackie, and thank you for having me on the show today. So basically, the risks associated with the vaccine in children, it's quite rare. They're quite minimal, actually, as we have looked at research from all over the world. So 12 to 15-year-olds in the UK have actually been vaccinated already. The people in the at-risk group, they've already received the vaccine, and even all over the world, in America and Europe, in Israel, Asia, they've been vaccinating 12 to 15-year-olds already, and with very minimal side effects or risks. There is a rare side effect that has been noted, and that is of myocarditis, which is inflammation around the heart, which is quite rare. I think they said it was, they vaccinated about 1 million children, and maybe about 60 cases in boys and 8 in girls, or something like that. So very rare. And actually, even when they have noted these cases, most of them are mild. Child is probably unwell for a few days and then recovers. There are a few maybe that have required admission, but nothing else. So yes, there are not many risks according to all the research that has gone. And even this risk of the myocarditis actually is after the second dose. As you can see, we are rolling out only first doses for healthy 12 to 15-year-olds in the UK because the MHRA and JCVI are waiting for just more research on the second dose. But yeah, that's
lovely. Thank you, Debisi. Just to introduce ourselves again, for those who've just joined, I'm Jackie Davidson. I'm a public health consultant facilitating this session and also program lead for the vaccination program in Greenwich. And this is Dr. Debisi, who's here to answer any questions. Please post everything in the chat and we'll be able to answer yours specifically. I have another question that's come in. Somebody has asked, why are children only being offered one jab?
Okay, so that's a really good question, actually. In the UK, I will say that you have to look at it this way. So in the UK, we are offering our healthy 12 to 15-year-olds and up to 17-year-olds at the moment just one dose. That's because research has shown that they do mount a very good immune response after the first dose. And the JCVI, who give us all our advice on immunizations, has said they want to wait and look at more research regarding the second dose for children. Just to repeat again, that we have been giving 2 doses to 12 to 17-year-olds who are at risk or who have immunosuppressive conditions, and they've been tolerating it well. But, you know, the evidence for healthy children at the moment in the UK, we are happy to go with the one dose, and we're just waiting for more information regarding the second dose.
Lovely. Thank you, Debisi, for that question. Another question from Paul Plume. If a child doesn't have the jab now, could they have it when they reach 16?
Yeah, I mean, they can. I mean, how old is this child? Obviously, if your child is going to be 16 like next year and you want them to wait, obviously they can have it. But what we know now with the immunization program, if your child doesn't have it now, you can always have a catch up, or if in a couple of months you think, oh, I want my child to have it now, then they can have it. So there's no restriction, but as you know, with COVID, everything is changing. There's more research being done. And I guess as we know more, we will follow the guidance. So this is what we know for now.
Thank you, Debisi. For those joining the live feed, I'm Jackie Davidson, Public Health Consultant and Programme Lead. I'm facilitating a session with Dr. Debisi, who's going to answer your questions on COVID. I have a new question from a Jeanette Ma. There was a study mentioned in The Guardian today that boys fare worse when having the jab than if they contracted COVID. Are you aware of this study? If yes, can you clarify what this means?
Okay, so I'm not aware of that study actually, but I can tell you from some of the research that has been done, as I was saying earlier on, basically the vaccine, the Pfizer vaccine, is very well tolerated in most 12 to 15-year-olds. However, there have been some rare side effects that have been picked up, and that's myocarditis or pericarditis, which is inflammation of the muscle around the heart. And it has been found that that is commoner in boys than girls. It's still rare, but it's commoner in boys and girls. And it usually, from what they've seen in the research, occurs after the second dose. So as I was saying, there's a study, I think in America, out of 1 million doses given out, maybe they had 60 cases in boys and 18 girls. Okay, so I'm not clear on that research that The Guardian has brought out, saying that the risk of having COVID is less than having the immunizations. I don't think I've read anything about that, but I can say that there is a rare side effect that can happen, and it's commoner in boys. But yeah, the risk of having COVID, as we all know, we're all still researching it. I don't think anyone generally will want to have COVID. I think it's always prevention is always better than care.
Thank you, Debisi. I'd like to ask a question from Tima Bensium. She said, if a child got COVID, how soon after can they have the vaccine?
Okay, so that's a fantastic question. We say that the child or adult can have the vaccine 28 days after they tested positive or they've had an infection. So from 4 weeks onwards, they can have the vaccination.
Lovely, thank you. Question from Julia Hibbard. How would we know the long-term effects on children when this is a new vaccine and we do not yet have much historical data?
That's a really good question. However, remember that the COVID vaccine is a new virus. We are in a pandemic still, and we are still learning. I mean, I think I was reading somewhere that it said that this is one of the this pandemic, this disease is one of the worst in the last 100 years. It stopped economies, stopped businesses, stopped us living life as we know it. And so many people all over the world have died. So a lot of research has gone into the COVID vaccinations, and a lot of research is still ongoing about the COVID infection itself, as well as long COVID, which so many people are getting, are debilitated by. So I would say that on the balance of looking at what we know about COVID and what we know about the vaccines, it's still better to prevent the infection if you can, or as research has shown, if you take the vaccine and you do get infected, you don't get really unwell from it. So the balance still shows that it's better to be vaccinated. And I know we all worry about the long-term side effects, but we have to think about what happens if we cannot live life as we know it. We know that the effects on children in the last 18 months has not necessarily been the COVID infection, but the mental health issues that have come from children not being able to have their social interactions, go to school, go to sports, have all those things. And those have been so significant. We want our children to live life as they should and to develop normally, mentally, physically, emotionally, and socially.
Lovely. Thank you, Debisi. For those who joined us, I'm Jackie Davidson, Programme Lead and Public Health Consultant for Vaccination Programme. And this is Dr. Debisi Olunluyo, and she's answering our questions today. We have a new question from Catherine King. She asks, will emergency equipment be available at at the school site? And how will we manage fainting and other issues with vaccines on site?
Okay, so the vaccines are going to be given by the school nurses, and we need to remember that the school nurses do give other vaccinations in school. So it's not any different. Yes, they will have equipment. They need to have equipment for anaphylaxis, that if someone has a reaction, they will be observing the children after they've had the vaccination for 15 minutes, as is the normal protocol. And we have asked that parents should please ensure that children have breakfast or have something to eat on the morning before they go. They're going to have the vaccination. And of course, if the children are worried or scared and they're going to, feel like they feel weak, there'll be measures they can put in, like telling the child to lie down, get a couch, or sit down. So, our school nurses are really brilliant, and they've been vaccinating, they do all kinds of immunizations. This isn't different. So yeah, I think they will have, they're well equipped to handle that.
Lovely, thank you, Debisi. Somebody has asked, Helen Cunningham, what are the symptoms of myocarditis?
So generally it will be like the child feeling unwell, might complain of some chest pain and have fever. Some children might have breathlessness. Those are the common side effects, common features, sorry.
Lovely, thank you, Debisi. Catherine King has asked, will those administering the vaccine be registered clinicians?
Yes. So the school nurses are going to be bring the vaccines, and they are registered clinicians.
Lovely. And certainly for the first two schools, we're working in partnership with our local GP practices, and actually we're going to have local GPs on site for the schools initially. But as Debisi said, we will be having registered clinicians who are vaccinating. Another question. Eileen, from my daughter, has anyone died because of having this jab?
You mean anyone, like adults and children? Is that the question, or just anyone?
I'm assuming it's relevant to the 12 to 15-year-olds. Has anyone died, or has anyone
I don't think there's
been
any.
Adults?
I don't think there's been any documentation of deaths from the COVID vaccination in children, especially 12 to 17-year-olds, or even a bit older. I think, research is still going on. There have been, obviously there are other vaccines that we're using in the adults, as in Pfizer, Moderna, and AstraZeneca, and there's still a lot of research and things going on as to causes of people who have died, post-COVID or post-vaccination. But in this group, I don't think there's any documentation. There's nothing that's come out about any child dying because of the vaccination.
Lovely. Thank you, Debisi. Another question from Catherine. Is there an option for children to have the vaccine at a hospital site instead of in school?
So, so all our healthy 12 to 15-year-olds are having, what we've given is the option for school. However, if you don't want to have your child vaccinated in school, you can contact your GP surgery and you could be directed to either a local vaccination clinic site, or in some hospitals, they are doing the children as well. So there could be giving information on where to book for those.
Lovely. Thank you, Debisi. We have another question from Jeanette. Jeanette has asked, my son has severe allergies. Is this jab recommended for a child with severe allergies? So
if you look at all the components of the vaccine, it does not have anything that should cause any allergies. So people with nut allergies, egg allergies, pollen, different things are generally safe. What the advice has been is, if you look at the components of the vaccine and your son is allergic to any one of them, then we wouldn't give him the vaccine. We would possibly refer to an allergy clinic and ask for advice from the allergy specialist. But most people that have EpiPens and are allergic to different things like nuts or eggs are able to take this vaccine. The only people that can't take the vaccine are if you are allergic to any of the components within the vaccine itself.
Lovely. Thank you, Debisi. For those who have recently joined our live feed, I am Jackie Davidson. I am the facilitator. I'm a public health consultant and the program lead for the vaccination program in Greenwich. And this is Dr. Debisi, and she is here to answer any questions that you have. We have a few more questions coming through. I've got one from Eileen. If we are vaccinating to protect schooling, will vaccinated children no longer have to isolate if there is an outbreak in their school?
So I think, can I answer that in another way? I think part of the reason we are vaccinating is so that we can prevent an outbreak and the need to lock down a school or keep children at home. That is one of the big reasons for vaccinating children. So we are hoping that if we get as many children as possible vaccinated in the 12 to 17-year-old cohort, we will prevent a breakout and a lockdown and people staying at home. So I think that's the way can answer that.
Lovely. Thank you, Dr. Debisi. We have a question come in from Paul, and Paul has asked, what are the probabilities of a 15-year-old, firstly, getting long COVID, and secondly, being hospitalized if unvaccinated?
So what we know is that most children, will get COVID and will probably have a mild illness or maybe asymptomatic. However, we have had a few children, thankfully not as many in the UK, but all over the world, who have had become seriously unwell, have developed symptoms and had to be hospitalized, and some children have had to be admitted into intensive care. So, on the balance, if you're looking at probability, I guess, I don't know, I don't have a percentage. We do know that a lot of children get COVID and they are fine, but then nobody knows who's going to be fine or not. As I said, COVID is still being researched. Even long COVID is still being researched. We don't know why why one person will have, two people exactly the same age, same medical history. One person will end up with long COVID and the other won't. So that's the only way I can answer that question. I think a lot of research is still ongoing and we're still looking at it and still finding out more, but yeah.
Lovely, thank you. Eileen had clarified earlier that her question was about the children, and you've responded to that. We have a new question from Stuart, and Stuart has asked, I have concerns that Pfizer is an mRNA vaccine, which is new technology with no history of widespread use in human beings. Are you able to comment on that, Debisi?
Okay, so just to give a bit of a background on that, mRNA vaccines have actually, the technology is not new. They've been working on it for years, actually. And obviously, when COVID came, remember that, obviously everywhere, it's affected every single country in the world. So a lot of money was thrown into the research. A lot of scientists collaborated across the world. We had a big cohort of people who volunteered for testing, and yes, a lot of research has gone into it, as we can see. And then, of course, we developed this mRNA vaccine that worked. I think that if you look at the amount of research and the amount of testing that has gone into this vaccines, all the COVID vaccines, if you look at some of our other vaccines, we probably didn't even do as much testing as has gone into these ones. And the reason is clear. We were in a pandemic. It was affecting all the countries in the world, and we were able to collaborate across the world and do enough testing. I mean, those are the things I can say about it that would help. We've also had loads of people take the vaccination now, and people have responded positively. If you look at the UK, last year we were in a completely different place than we are now. And part of the reason is because of the vaccination. So I can only reassure you that the mRNA technology that was used for the development of the COVID vaccine isn't new. It's just obviously in this instance, they were able to develop it further and use it for vaccination against the COVID virus, sorry.
Lovely. Thank you, Dr. Debisi. I have a question that's come in from Tima, and Tima has asked, are there any contraindications for children who suffer from chronic fatigue?
So there are no contraindications at the moment. In fact, we are putting our children that have immunosuppression, chronic fatigue, possibly falling in there with neurological problems. We're actually getting them vaccinated with 2 doses because we worry about their immunity, they've been able to mount a proper immune response as to, healthy children. So there's no contraindication for that, and I would say they can have the vaccine.
Lovely. Thank you. Thank you for that, Dr. Debisi. For those who have recently joined us live, I'm Jackie Davidson. I'm the Programme Director for Vaccinations in Greenwich and a public health consultant in facilitating this session today. This is Dr. Debisi, and she's here to answer your questions. Please, can I encourage anyone to post whatever they want within the chat, because it's really important that you get the information that you need today. I have some more questions coming through, so if okay, I'll start asking those to Dr. Debisi. I have one from Eileen. I have heard that some women who have had the vaccine have changes to their menstrual cycles. Is this a coincidence, or is there something hormonal going on that could affect adolescent girls?
Yeah, thank you, Eileen. So going back to how the mechanism by which these vaccines work, they do not touch your hormones. They do not interact with the hormones. And the way maybe I should just quickly say how they work. Basically, the mRNA vaccines, they carry like a little message into your body. Your body produces proteins, which are like the proteins on the COVID virus, and stimulates your body to create a response, an antibody, so fights it off. It realizes it's an enemy and produces an antibody response. And then after a few days, I think maximum 5 days, it disappears from your body, okay? But what it has done is that it's giving your cells a memory. So if the COVID virus, if someone tries to pass on the virus to you, your body remembers and then produces antibodies and kills off the virus. So then you don't end up getting infection, or if you do get the infection, you have very mild symptoms. There are no hormones in the vaccine. It doesn't affect the hormonal cycle. It doesn't affect fertility. We have got the Royal College of Gynecologists who have actually looked into this and have come back saying it has no way in which it affects these areas. Okay.
Thank you, Dr. Debisi. It's clearly a cause of concern to many parents, and also related to that, fertility. And actually, we have a new question from Nicola about the research of vaccine effects, whether the vaccine affects fertility. Just before you answer that, I think it would be useful if, as part of this, we actually put the Royal Obstetrician's link to the information so that you have a lot more detailed information. But would you like to reflect on Nicola's question?
So yeah, thank you, Nicola. No, so it doesn't affect fertility. After a lot more research was done, and initially, if you remember, we were not offering the vaccine to pregnant women, but then there was a lot more testing, and pregnant women, we found that it was safe in pregnancy. And so now all pregnant women are being offered the vaccine. And this is worldwide. This is not just in the UK. So it doesn't affect fertility. And women who are planning to get pregnant, we are happy for them to have the vaccination because we know it does not interrupt their menstrual cycle, their fertility, or their hormones.
Lovely, thank you. Just to say, this is, again, for anybody who's joined, this is Facebook Live, and it allows you to ask any questions that you have regarding the vaccination programme for 12 to 15-year-olds, or your older children if your child is 16 or 17. This is Dr. Debisi Olunluyo, and she will be answering any questions that you have today. I'm Jackie Davidson, I'm the facilitator for today. I would ask, please keep posting your questions. This is your opportunity to ask any questions. just whilst we wait for more people to post additional things, I just wanted to ask you, because clearly there's many children who will be having the vaccines as part of this programme. Can you just tell us a little bit more about what we can expect on the day or the day after in terms of the, not the serious side effects that you've talked about, but just what we can expect for the majority of children, what will happen them in the 48 hours after?
Okay, thanks, Jackie. So obviously, when anyone gets a vaccination and with the COVID vaccine, you might get a bit of soreness in the arm that could last probably 24 to 48 hours. Some people get a mild, like headaches. Some people might get a mild fever or feel like, oh, they're run down with a cold. Usually lasts 24 to 48 hours, and then it resolves completely. And a lot of children might even be completely fine. So you might be completely well, no soreness, no fever, no headaches, feel well. But then, you know, a few people could get that. And usually we recommend that they just have some paracetamol and lots of fluids, and usually they're fine.
Lovely, thank you. We had a slight bit of freezing there, but hopefully everything's okay. So what I would just like to ask is, I can't see any more questions just yet. Let me just double check. But whilst I'm just having a look what's coming through on the feed, can you just tell me, Debisi, some people are asking about younger children. So if a child is 11 or 10, would they be able to get vaccinated?
So at the moment, we're only doing from age 12 and above in the UK. As we know, they're still doing research about vaccinating younger children, but in this present cohort and rollout, it is from the age of 12 and above.
Okay, that's lovely. Thank you, Debisi. For those who've just joined us, it's Jackie Davidson. We're having a live feed. I'm the facilitator for the event, and this is Dr. Debisi. I would encourage you to post any questions that you have. It's been some great discussions and some great questions asked, so please continue to post them. I just want to ask, so if a parent is worried about their child having the vaccine, what could you recommend to them in terms of giving them more information, perhaps outside of this event?
Right, so yeah, I mean, if anyone has any concerns, I would ask that you go to the NHS website, our own NHS SCL-CCG website. On this Facebook page, if you click on the website, you will see it takes you directly to the page, and there are lots of questions about vaccines, frequently asked questions. We've got videos on there, you know, useful tips and information about the vaccination, what is in it, and things like that. Otherwise, you can go to the gov.uk website as well, and it has information about the vaccines and questions asked and things like that. I mean, obviously, we also, you have your local GP, you can ask questions, and we now have a COVID vaccine helpline that you can self-refer to via a web link, and I'm sure we can put that on Facebook. And we've got clinicians who are there Monday to Friday, 9 to 5, who can answer any questions, concerns, or queries about the COVID vaccine. So those are the various areas.
Lovely, thank you, Debisi. I just was asked to clarify regarding the whether there'd been any deaths in terms of people, young people who'd had vaccines, and I just wanted to clarify what that position was. So there have been a number of deaths, but I think a very small number of deaths. But I think what we have to do, and there's been 14 in total, and they're clarifying exactly in younger age groups, and they're clarifying exactly what were the causes. And those causes are very mixed. And they include actually suicide. So when somebody dies after a vaccine, it may or may not be related to vaccine, and therefore there is investigations into each of those. So I just wanted to make sure that just put that context in. But I think the other context is that's in response to 7 million vaccinations that have been given to that age group. So as Debisi had set out earlier, in terms of all the other issues that children suffer from not being in school, from passing it on to older people, all of those other things, the context is that, and the balance is why we have moving forward with the 12 to 15 programme. So I'm not getting any more questions through that I can see. So if there are nothing more, then I will be able to wind up this session. I'd like to say a really big thank you to Debisi for joining us today and answering all of those questions. Please, if there's anything more, continue to post them in the chat, and we'll be able to answer those outside of this event. It's been a pleasure to meet all of you virtually, even if I can't see you. And thank you for your very thoughtful and good questions. Thank you and goodbye.
Thank you for having me.
Pleasure. Thank you.